Hello and welcome to Wellness Wednesdays. I'm Dr. Stephen Ramos, Associate Medical Director with HealthTexas Primary Care Doctors. And every week we're going to bring you a video with special guests discussing important health topics. Well, welcome back to another Wellness Wednesday. I'm Dr. Stephen Ramos, and today I have Dr. Nagi here with me, a doctor of ophthalmology. Dr. Nagi, thank you for joining me.
You're welcome. Thanks for having me.
And if you just want to give the audience a little introduction to yourself, that'd be great.
Sure. Hello, everybody. My name is Kundandeep Nagi. I am a physician. I'm a glaucoma physician, actually. I'm from upstate New York, and we came to Texas. I did a fellowship in glaucoma at Houston, and we've been in San Antonio now for about 10, 11 years. I was at the University Health Science Center at Texas for about 5 years, and then I recently joined private practice, part of San Antonio Eye Center, for about the past 5 or 6 years.
Great. Well, we've been using your group for a while for, basically anything eye-related for the most part.
Thanks.
But for our general listeners out there, tell us a little bit on what can we do, as far as making sure our eyes are healthy and staying on top of that.
Great idea. I always tell patients that the eyes are just basically an innocent bystander, typically, most of the time. If you can take care of your health, if you can take care of your body, food, diet, exercise, all that stuff, your eyes will follow. Of course, there's some other issues like glaucoma and some other eye-related issues particularly, but the vast majority of the stuff that we see is diabetics-related. And if you can maintain a good sugar control for a long time, your eyes will be fine.
Great. And how often should somebody get their eyes checked? How often they should be coming to see you?
Yeah, if you're a diabetic, you're going to have to come in at least once a year, minimally. I think the stats in Bexar County for diabetes is 1 in every 7 people are diabetic type 2. So pretty much a lot of people are going to be coming in at least once a year. You can get a general eye exam under 40, just really as needed, as an as-needed basis. But the incidence of diabetes is great. It's rampant in Texas, minimally once a year. Of course, we all know that eye-related problems are directly proportional to sugar control and length of diabetic control. So if you're well-controlled, you're going to be fine. But if you're an uncontrolled diabetic who's had it for 10, 13, 14, 15 years, you're probably going to need to be seen more often. And the reason we ask people to come and see us is that diabetic-related eye disease can be controlled. It's one of the leading causes of reversible blindness. So we can help you. We can help with lasers. We can help with surgery. We can help prevent this horribly, horribly blinding disease. Yeah, and
I've got a lot of patients who maybe have had diabetes for 10, 15, a long time, but you know what? They're not on medications. Their blood sugars have been doing very well for years and years and years. And sometimes they ask, well, why do I still need to keep going to the eye doctor? Do you have a good answer for that?
Yeah, great question, because in the early stages, diabetic eye disease is asymptomatic. But we can see blood and swelling on the back of your eyes. And you can't just see that. You may have good vision, but the progression of that disease is such that you're going to be on a slope that is not doing well. And then the only reason for us to really know is that if you get your eyes checked. So you can get very non-proliferative, the early stages of diabetic eye disease is called non-proliferative diabetic retinopathy, and you can have early non-proliferative disease, and then maybe your sugars are well controlled, but maybe they need to be controlled better. If we see stuff in your eye, that means at some point in the past 5 to 7 years, your sugars were out of control. So maybe they're better right now, but 10 years ago, maybe they weren't that good.
Yeah. And so what about if I have a patient who says, well, yeah, I hear what you're saying. I don't want to, go blind either for my diabetes, but I went and got some glasses last week or, 6 months ago. Does that count? Is there a specific kind of exam?
Not really. Great question, though. Optometrists are great. Actually, optometrists can do dilated eye exams, but an optician or somebody just that gives you glasses that doesn't dilate the back of the eyes, that's a no-go. It's not going to work. The eye disease from diabetes is what we call a microangiopathic problem. So it affects the small blood vessels, not only in the eyes, believe it or not, in the kidneys as well. There's a lot of correlation between nephropathy and retinopathy in diabetic-related disease. Anyhow, we can't see in the back of the eye unless we get your eyes dilated. And so you need to have one of these dilated eye exams. You're going to be blurry for 4 to 6 hours. It's a pain in the butt. Nobody likes it, but you got to get it done.
Yeah, absolutely.
Absolutely. And then, so that is just the early stages of diabetes are very like bleeding and a little bit of swelling. But later on, as sugar levels, get higher, or if they're higher for a long amount of time, some of the blood vessels just don't work anymore. They occlude. And then the eye gets hypoxic. It needs oxygen. And that's a whole separate level of diabetic-related eye disease called proliferative diabetic retinopathy. and that portends badness, basically.
We want to catch people before they get to that point.
100%.
Obviously.
100%.
So if you do have diabetes and you're listening to this right now, you know what? Can't remember the last time you had your eyes checked, or you're not really sure anyone's actually dilated your eyes and you've had a good exam, or you don't really know who your ophthalmologist is.
Yeah.
I think it's time for you to maybe reach out to Dr. Nagi and Stack and schedule that appointment, because we want to catch things as early as we can so that we don't run into problems later on. Losing your vision is something I can't imagine having to deal with, especially in a lot of our younger patients who, I get a lot of times where, yes, I have diabetes and I hear you, doctor, I know I need to get control, but you know what? I feel good. I feel fine. I think I'm just going to stick. These are one of the complications that we just talk about so often that is preventable.
Correct.
As long as we take the steps needed to stay ahead of it.
Correct.
So, well, great.
We have, if you don't mind me interrupting, we partner, HealthTexas partners with a group called STEC. It's called South Texas Total Eye Care. So these are a group of privately owned ophthalmology practices throughout San Antonio that help with people getting their eye care. And they partner with HealthTexas. So one of the major goals of STEC, not just San Antonio Eye Center, but Alamo Ophthalmology, Alamo City Eye as well. We want to be able to get people in quickly and do their dilated eye exam at minimally once a year, get them in, go on your day. At least you can say, okay, we're good for that 1 year.
Absolutely. And then, so we talked a good amount about diabetes, but what are some other common eye concerns or things that some of our older patients, 65 and older, really need to be focused on and being attentive to?
Yeah, great question. The diabetes is number one, but number two, so many of our patients have cataracts. Cataract surgery is the most common ambulatory procedure performed in the U.S. The number one risk factor of cataracts is age, right? So as we grow older, we're all going to get cataracts. By the way, if you're a poorly controlled diabetic, you're going to get a cataract much quicker, much sooner, and much worse. So cataracts is a very, very common problem that we have, and it's very easily curable, treatable, basically with cataract surgery, thankfully. Let's say you do get checked for diabetes, and your doctor says, "Hey, there's some blood in your eye, and there's some swelling here and there. What can we do for that? Am I just hosed? What do I do?" No, there's lasers, there's treatment for it, at least in the early age, because we want to prevent you from ever noticing you're diabetic, right? So our goal is to take care of your eyes, so you never know you have an eye problem. Let us take care of that. So cataracts is the other one. And I might mention that I'm a glaucoma physician, so I can tell you that we see a lot of glaucoma. Again, by the way, one of the biggest risk factors other than age for glaucoma is diabetes. And diabetes will give you a type of glaucoma that's horrible. It'll shoot back to that second, more proliferative diabetic type disease and give you a very, very high pressure, very, very painful eye. And that can cause irreversible vision loss.
Yeah. So, a lot of times, people that maybe haven't reached out and gotten their screening, or maybe they have, and what are some other symptoms or some things, maybe their vision's doing okay. Is there anything else that we can kind of tell those listening of, those red flags and things to look out for? Okay, wow, I'm noticing this. I really need to call my doctor and get my eyes examined.
Sure. Any changes in vision, very often people notice cataracts more when they're driving at night. So glare, halos, stuff like that. People can have, as sugars go up and down, they can have variable vision. In the morning, my vision was this, but later on it goes like this. They can have sort of variable vision. Eye pain is a big one, not really so much for diabetes, but in glaucoma. Anytime you have a really red, painful eye, you should probably go and see. I give people three things. If your vision suddenly decreases, if your eye suddenly gets red, or if you suddenly have eye pain, go to the eye doctor. Those are like the three red flags that basically anybody should know about. And we should take a look at that if that happens. Yeah,
and so those are a lot of things that we look out for. If I have a patient that I know very well and they call up and they say, "Hey, my eye is red and painful and it just started this way."
That's a problem.
And hey, do you know who your ophthalmologist? Yes? Okay, give him a call. And so having that already established connection and familiarity with somebody is really important for if something does come up like that. Dr. Nagi's going to take care of me. I can give him a call and I can get seen and we'll take care of my vision.
Yeah.
So just another good reason why making sure you're staying on top of your eyes, you're getting your exams as you need them done so that you know everyone who's taking care of you.
Absolutely. And we probably, as physicians, probably need to do a little bit better about communicating myself with the primary care doctor or this specialist and that specialist so that at least we know that, patients have so many different doctors and they have so many different diseases. It probably behooves us to be a little bit better about, closing that loop and making it a little easier on them. We certainly try to do our part into doing it, but I believe that, there's always room for improvement.
Yeah, and I think the communication is incredibly important, especially when we talk about medications. If I have somebody with glaucoma or other eye conditions, I have to make decisions on what medicines I'm going to give them because I don't want to make that glaucoma worse. I don't want to complicate things. Same way with certain other types of eye medications, certain drops, there can be some systemic side effects.
Absolutely.
If I don't get that note from you or that understanding of how you're treating that patient, well, I may not think of why they're having that problem. So, again, I agree with you. The partnership we've had has been very, very beneficial for our patients. It makes our jobs a lot easier, that's for sure. And, hopefully we're taking care of our patients and keeping their vision.
And I would say that on the flip side, I would say to all those patients listening, like when you do come and see a subspecialist, please try to at least help you in terms of getting a hold of your doctor. So a lot of people, they don't know their primary care doctor. They don't know who to refer to them. They haven't seen a regular doctor, right? So those are all things that are really important. And at some level, there needs to be some sort of responsibility there as well.
Well, great. Any other tips as far as, our older patients out there listening of, again, you mentioned keeping your body healthy, keeping your medical conditions under control, visiting your primary care doctor, obviously.
Yeah.
Are there any food, supplements, exercise, anything else you can give as far as tips on how to keep your eyes healthy?
Let me, I'll just quickly tell you something about glaucoma, because glaucoma is really hard, and the number one risk factor is age. We all have an aging population. San Antonio, Bexar County, they're all aging. The number one risk factor for this disease is age. And like diabetic, at least early on in the disease, you really don't know that you have glaucoma. The only way really to tell is to get an eye exam, typically. Very often people have a family history that they may or may not know about. So if you have any brothers, sisters, family members with glaucoma, or anybody taking drops chronically for a while, you should probably get checked out as well. So glaucoma is a disease that affects the optic nerve. That's the thing that connects your eye to your brain. And if that optic nerve dies, your brain doesn't get any visual input. If the brain doesn't get any visual input, you lose your vision. And nerves, unlike other parts of the body, don't regenerate. So this is, as opposed to others, so this is a irreversibly blinding condition. And very often people don't know about it. Yep. And the thing that we can control with glaucoma is your eye pressure, which is why we check eye pressures all the time, which is why people are on drops. And to your point, these drops do have some systemic side effects. So it is important to have that collaboration. But I would say, hey, if you're healthy, that's fine. But, hey, brother, hey, sister, how's it going? What, any issues going on? Or mom and dad, hey, look at their health. Family history ends up to be, a pretty important thing. Yeah.
Well, great. Any other kind of comments about your group and your practice? Anything you want to get out there to those that are listening?
Yeah. So STEC has everybody. We have all the subspecialists that you'll ever need, from cataract surgery to glaucoma to retina. We have a great plastics people as well. If you guys are interested in cosmetic surgery or, lid lifts and, facial resurfacing, all that stuff as well. So STEC really has a sort of a comprehensive eye care mentality. And they're, again, throughout San Antonio. So really for all your eye care, pediatrics. We have pediatrics for all your eye care needs for you and your family. That's sort of a one-stop shop.
Yeah, it makes life very easy for us. Eye problem, STEC, and I know that no matter what happens, no matter what road they're going down with their eye health, I know they're taken care of.
That's right.
So where is your office very specifically?
We San Antonio Eye Center has about 10 or 11 different locations throughout San Antonio. So we have 4 or 5 downtown. We have one on the north side, east, south side, and sort of throughout San Antonio. So I'm the only glaucoma physician there, so I end up going everywhere. Okay. But a lot of our physicians sort of stay in one practice or the other. But we try to make it easier for patients, so we're the one that are traveling and not sort of them.
Gotcha. And we'll put the information for STEC and Dr. Nagi's office down in the links below. That way you guys can, if you are looking out for an eye checkup or you need to get your vision checked, we have some resources available for you.
Yes, sir. Sir.
Well, again, Dr. Nagi, that was great information. I appreciate you coming on and talking with me. A lot of very useful things I think that a lot of people need to be aware of. And hopefully you get a bunch of calls about some patients coming in for you.
Thank you very much. I just remember one more thing that I'd like to mention, if you don't mind. So many people complain about these fluctuating vision. My vision's really, really great one time, and then it gets blurry, and then it's really good again. And it ends up that the incidence of dry eye is very significant, especially now that we're all online, we're all on the computer, we're all doing web conferences, we're all doing Zoom calls. At the very least, an artificial tear never hurt anybody, and they're all over the counter. So I would say for the majority of people out there, if you're having some fluctuations in your vision, at least you can try a teardrop 4, 5, 6 times a day, more if you're on the computer, more if you're driving all day, in which a lot of people are. So teardrops.
And also go get your eyes checked.
And go get your eyes checked.
Problems, get your eyes checked. All right. Well, Dr. Nagi, again, thank you very much. And everybody out there, I hope you guys have a wonderful Wednesday. Thank you for joining us for Wellness Wednesday. Again, I'm Dr. Stephen Ramos with HealthTexas Primary Care Doctors. If you have any questions or want to reach out to us, our phone number is 210-731-4800, or you can visit us on our website at healthtexas.org.